Well, sorry for that little delay there. We've got those tech gremlins all corralled, and we're back on the main stage for a session on a pretty innovative initiative that could help revive our visitor economy. Nous voilà de retour sur la scène principale pour une séance portant sur une initiative assez novatrice en mesure d'aider la relance de notre économie du tourisme. On a beaucoup entendu parler dernièrement de la façon dont les plus grands aéroports du Canada étudient la viabilité des tests du dépistage rapide. There's been plenty of news lately about how Canada's largest airports are studying the viability of rapid COVID-19 testing. Our special guest, Nicola Colville, is the Area Manager of Canada and Bermuda at IATA. She's going to moderate the next session in your 2020 Resilience Toolkit. It's called Game Changer, Rapid COVID-19 Testing. And I'm really looking forward to hearing from the people on the front line of this exciting initiative. Nicola, over to you and the panel.
Thank you, Catherine. Thank you for the introduction. I'm absolutely delighted to be here today to moderate this panel discussion entitled Game Changer, Rapid COVID-19 Testing. I'd like to thank TIAC for including this important topic on the TIAC Tourism Congress agenda and for inviting me and our panelists to share our insights on COVID-19 testing and, importantly, how testing can help revive air travel in Canada's economy. My name is Nicola Colville, and I'm the Area Manager for Canada and Bermuda for the International Air Transport Association, IATA. And it's my pleasure to introduce you to our esteemed panelists. Lawrence Mahan, who's the Senior Vice President of Commercial Diagnostics at Life Labs. Lawrence, welcome. Laurie McKee, the Director of Public Affairs and Stakeholder Relations at the Greater Toronto Airports Authority. And Robin McVicker, who's the Vice President of Operations and Maintenance at the Vancouver Airport Authority. Ladies, welcome. International air travel has plummeted more than 90% compared to 2019 levels due to government-imposed travel restrictions. This has had an absolutely devastating impact on the aviation industry and has led to huge job losses. IATA is calling for the development and the deployment of rapid, accurate, affordable, easy to operate, scalable and systematic COVID-19 testing for all passengers prior to departure as an alternative to quarantine measures in order to re-establish global air connectivity. I'd like to start by inviting each of our panelists to give about a 2-minute overview of the important work that they're doing on COVID-19 testing and how this could help to safely reopen borders. Lawrence, let me turn to you first.
Thank you very much, and thank you, TIAC, for giving us the opportunity to speak on this very important topic. Life Labs, for those of you that have not heard of us before, we're Canada's largest private medical lab. We're wholly Canadian-owned and Canadian-operated. We're very proud of that fact. We report out about 120 million test results every year, and we do this through a network of very automated and highly regulated laboratories in Ontario and BC. We also have a network of partners outside of those provinces. Since the beginning of COVID, we've been very involved in public health testing programs for COVID. Again, we're very proud of that fact, but we've also seen the need for a response to COVID from the business community. And in response to that, Life Labs developed a turnkey service, which was evidence-based, to get Canadians back to work, travel, and play. Our labs have been processing almost 1 million COVID tests since the beginning in May. And this year we launched the WorkClear program, which is a program designed to provide a licensed accredited service to employers wishing to provide a high degree of confidence and security to their employees and to reduce the likelihood of COVID transmission in the workplace. And now we're seeing this demand from international travel, where more and more destinations are requiring a confirmed negative COVID result. And within a certain time frame of 72 hours, and in the case of China now, 48 hours. So shortly we'll be launching a service that we're calling FlyClear. And this service will provide a convenient, affordable way to book a test, receive a result within the required format with the required turnaround time from a lab that meets the licensing and accreditation requirements. We're also exploring options for testing inbound travellers in the event that testing is found to be a safe and reliable replacement. So some exciting news that I think Laurie will be talking about. And in conclusion, we're proudly Canadian. We're proud of the role we're playing in supporting public health and private sector, and we're very proud of the work that we're doing at this time.
Thank you, Lawrence, for that overview. Clearly, a lot of good work underway. Laurie, turning to you, early September, McMaster Health Labs launched a study of international arriving passengers, testing them on a voluntary basis for COVID-19. And just yesterday, I read, as I'm sure many others have, the an interim border study report. Tell us more about this initiative.
Yeah, sure. Thanks, Nicola, and thanks to TIAC and to my fellow panelists. Really happy to be here to talk more about testing and why it's such a critical next step for us to reopen travel. You and your tourism businesses know that Canada's airports are your front doors to international arriving passengers. People aren't flying to our airports; they're flying to do other things in the country, to your destinations and attractions, and so. We want to make sure that we're supporting that movement of travel. And since COVID struck, we at Pearson have been down 98% initially. Today, it's not that much better. We're down about 88%. So that's a far cry from where we were at a 50 million passenger airport. There's lots of things we've been doing to reduce our costs the same way tourism businesses are doing that and accessing government programs. Unfortunately, we've seen layoffs as well in our business. We've rolled out a program within the airport that we call our Healthy Airport commitment. And so those are foundational things like you would see in your own businesses around masks and distancing and cleaning and hygiene, following international best practices. But we know that testing is going to be part of moving forward and reopening. And so we're taking steps to be on the forefront of that. Nicola, the study that you mentioned, that was a study we did in partnership with Air Canada. It was led by McMaster Health Labs, so it's a group of researchers from the University of Toronto and McMaster. It started in early September, and it took its last enrollment October 31st. More than 16,000 people were enrolled and 40,000 samples taken, so a really good, healthy number. What it was looking at was looking at COVID infection rates of incoming international travelers, determining if an airport-based surveillance program is feasible, looking at whether self-collection by passengers is an effective tool, and also really digging in to see about the options regarding the 14-day quarantine. So people volunteered to be part of this. It was happening in Terminal 1 at Pearson, so any international arriving passenger could volunteer to be part of it. They were shown how to do a self-swab and then given a kit that they took home, and they did a second sample on day 7 and a third sample on day 14. So we believe that this is the largest of its kind in the world. And as Nicola mentioned yesterday, the results or the preliminary results were released. So it's showing that 99% of arriving passengers are testing negative. And of that 1% positive, more than 70% of those were caught on the first test, and the balance primarily on day 7. So it's starting to give us some really good data to support and a reduction of the blanket 14-day quarantine. You think about it, if you're adding an arrivals test, how can that regime provide a viable alternative to a quarantine system that we have today? So just wanted to also mention, I mean, it's not different from what we're seeing happen in Alberta already. So there's a land-based and an airport-based program that the province has started there with the federal government, where after a negative test on arrival and an agreement for some certain conditions, and then a second negative test, individuals are relieved of quarantine. So really positive steps. Obviously, these aren't rapid tests. We're a ways from getting to that, and that really will be the panacea for us in the aviation sector. But these are important first steps and giving us good data to help support public policy.
Important indeed. Thank you, Laurie. We'll be watching this space with interest. Robin, over to you. We're certainly equally interested to give more insight into the pilot partnership that the Vancouver Airport Authority is currently focused on.
Thanks, Nicola, and great to be here at the TIAC Congress. It's important to us. We appreciate the opportunity to talk with our partners here on the panel and to the industry as a whole about how testing can be a game changer in terms of restarting and reopening aviation. For me personally, it's important as the Vice President of Operations here at the airport, but also as the Vice Chair of Tourism Vancouver. I recognize how important the tourism industry is and the impact that aviation has felt as a result of COVID. You know, at YVR, we were on a record trajectory of growth for many years, and we've seen the decline just in a short few months. So like Lori talked about, we're today off about 83% from our 2019 numbers. And while we're talking about passenger numbers, we know that from a tourism industry perspective, that's jobs, that's people that drive taxi cabs and hotels. It's the florist that does the table center for the meetings that people are having, and it's the catering. So the knock-on effects are huge. And what we've really tried to do is be present in the conversations and drive some solutions. How do we get aviation open again? But it's a balance. It's a balance because we recognize that the most important thing is the safety of Canadians and of passengers and of travelers. So while we talk about how do we start aviation, how do we start tourism again, we also need to think about what's in the best interest of the public and how do we manage that conversation well. And you know, we have looked at a number of different initiatives over the past, what has it been now, 10 months in terms of how we're going to get through. Our number one job at an airport is to create a safe experience for our passengers, for the community that we serve, and also for the employees that work here. So immediately after COVID started, we created a program, a little bit like Lori's Healthy Airport program. We call it YVR Take Care. It's an initiative that refocused all of our efforts to ensure that we are creating a safe travel experience for those who do need to travel, because as we know, people are still traveling. And what we also know is that the rate of infection on aircraft is almost negligible. It's not there. So we've had good information on that. But our job is to create a safe experience at the airport. So the YVR Take Care program looks at making sure that we have things like the mandatory mask policies for employees and passengers. It's a multi-layered approach. The next step in that, of course, is all about testing. We believe that testing will open up and restart aviation in the future, but we need to do it in partnership with the health authorities in the provinces, as well as the federal health authorities and the airports across Canada and the airports around the world. You know, we know that people don't just travel to YVR to and from, they're going somewhere and they're coming home. So how do we drive standards and information nationally and globally that provide a testing solution? And we're certainly part of and driving a number of those conversations. So as Lori talked about the great program that they have initiated with Air Canada at Pearson, that's on the arrival side. We worked with WestJet to talk about what would testing look like on departure. And we think that ultimately there will be a multi-layered approach to testing that will probably have elements of both departure testing and arrivals testing. So how can we as the aviation industry really trial some of these opportunities? The program that starts, it launches physically at the airport on November the 23rd, is a partnership between WestJet, UBC, so the University of British Columbia, and Providence Healthcare, and of course YVR. And our test is different in that we are doing a screening test. So we are actually using a rapid antigen test, not a PCR test. We've got two real objectives here. Number one is to test the test because Canada hasn't had a lot of experience in having the rapid antigen tests out in the market. We're testing that type of test at the airport, and we're working with a few different providers. Additionally, we need to test how does this concept work at an airport experience. We believe that once we can get that moving forward, we think that the rapid antigen approach could really unlock aviation, but also unlock the premise of rapid antigen testing to other industries and other opportunities. It will be a voluntary opportunity focused on domestic travelers at first. We just need to make sure that we keep everything really focused and clear. The results will be provided for us by UBC and Providence Healthcare. We thought it was really important that we ensure that we have the right level of academia that leads the professionalism and effectiveness here. So we're looking forward to the responses that this will bring and how we can share that data. Our job is to try to make sure that we can give verifiable information to the government and that we can work with them on looking for ways to remove quarantine and open travel up again. Thank you very much.
Thank you, Robin. And we'll likewise be watching this space. It's clearly an active discussion and looking forward to see how that game changes in the near future. So having set the stage, if you will, let's get into our panel discussion. It's clear that governments must find alternatives to border closures and quarantine requirements. These are causing economic devastation, and they've essentially brought the Canadian aviation and tourism industry to a virtual standstill. What needs to be done to get the Canadian government to greenlight a system that keeps Canadians and visitors safe? Laurie, let me start with you.
So I think everyone's agreed that COVID is going to be with us for some time. And so we need strategies that can support reopening of travel in a safe way. You know, it was really easy to close our borders. It's proving to be much more challenging to reopen. And, you know, a vaccine's going to come along, but even then, I think it won't be as readily available as we might hope. So that's why we are jumping in. Now, other countries have moved forward with risk-based systems involving testing to support air travel. We've seen many destinations require a negative COVID test pre-travel in 48 hours or 72 hours before. Canada's continuing to follow a blanket approach with a 14-day quarantine and has not spoken up publicly about a testing program. We know that there's work underway. And as Robin said, we really need a standard approach. I mean, industry is doing what industry does so well, and it's filling the gaps, it's trialing things. But to rebuild confidence in air travel and trust in travel, we do need a unified standard approach. And so we continue to pursue a standard approach to testing, whether it's pre-departure, with a backstop of an arrivals test for a period of time, a combination of number of days between tests. But we do need a standard approach that we all can follow and start to get people back traveling again in a safe way.
Right, we're such an interconnected and global industry, right? So harmonization is key to that success going forward. Thank you for your insights. Robin, turning to you, what do you think the Canadian government needs to do to get that green light?
Sure. In addition to what Laurie highlighted, there's a couple things that I think we need some help from the government on. We need to move faster. We need for the government to move faster, and whether that's in approving different types of tests, making them accessible, making them available, we need to move faster like we've seen in other countries. So we would ask that the government and health authorities and ministries that are involved in that look towards that. The other thing the tourism industry needs, and I'm going to call it out from an aviation perspective, is we need support. We've seen support from the federal government go to aviation in the US by bucket loads. We've not seen any support from aviation, airlines, airports, or anything. We recognize that that is a real challenge. And then finally, it comes down to scalability. So if a testing program does go into effect, how do we ensure that people actually continue to have access to travel? Whether it's a screening test or a diagnostic test, the cost of those are significant. Where does the cost lay, and how do we make sure that there's a business model that supports the people who can and need to travel and ultimately the economy itself?
So some very specific requests there, which I think warrant underscoring in the hope that we have some of our Government of Canada partners in the audience, and that is for government to move faster, and that is for financial relief. Thank you for that. Lawrence, would you like to add anything to the comments already shared by Laurie and Robin?
No, I agree. Actually, I agree strongly with what both Laurie and Robin have been saying. Being on the laboratory testing side of this conversation, it's interesting. We're actively looking at other technologies that are coming to market, and we're very interested in integrating them. But I really don't think there's going to be one perfect solution. It's going to be that layered approach that Laurie talked about. I do think it's critical that whether it's a digital, whether it's self-assessment, whether it's point of care, whether it's lab-based testing, that all of this is actually integrated into the public health system and COVID reporting systems and managed in accordance with provincial regulations. I think that's critical. And maybe the only other thing I'd say is COVID's a very tricky virus. 40% of people are asymptomatic and 100% of people are pre-symptomatic. And the incubation time is median about 5 days. So people are actually more infectious the day before they become symptomatic, the ones that do become symptomatic. So it's very challenging to find the right kind of testing program that can identify those people early enough that they're not infectious and not going into congregate settings. And I think that's, there's the technology side, performance of the technology, and then there's just the pure logistics side. So it's going to take a consortium of people to solve this problem.
Indeed, it's certainly a collective effort. This is probably a good segue to the next question, if you will. Globally, we've seen a few models for rapid testing throughout the travel process, and I'm interested to hear your respective views if Canada should be looking at pre-departure or on-arrival testing or both. Now, I know that you spoke to some of this in your introductory remarks, but maybe to zone in on this more specifically. And also, if you have any recommendations around which model you think would provide more confidence and security to travelers and Canadians. Robin.
I think there's some great models out there, and I know that the federal government is talking to airports, aviation, all over the world. So they are reaching out, and I want to applaud them for that. Two that I would highlight, Fraport. So in Frankfurt, Fraport, the operating company, has done a phenomenal job at working with the health ministry in Germany to set up a testing site, and it's actually done by a third-party provider, so somebody like a Life Labs that's responsible for that. It's a good business model. It is available, scalable, and it's working well. The other one that I would say is why keep it to aviation or airports? Let's think broadly. We've seen some really good work out of rapid frequent testing at university campuses in the States. How do we learn from that? How do we incorporate that into our daily lives so that it's beyond just travel and tourism to deal with a little bit of what Lawrence was talking about that pre or asymptomatic component?
Thank you very much. Lawrence, did you want to add to that, further to your previous insights?
Only to say that the lab at the site is a really interesting model for us. One of the lag times in lab-based testing. So one of the pluses about lab-based testing is you have the highest performance, sensitivity, specificity, and it's hard to reproduce that at a point of care level or even with antigen testing. The lab-based antigen testing has a higher performance, more sensitive, more likely to pick people up early in the infection, which is when you want to detect them. But the idea of not having to transport the specimens and being able to rapidly put specimens on a high throughput instrument should provide the lowest cost, should provide the fastest turnaround time, and should provide the highest performance. And I think we'd all agree that those are all the critical components of that.
Thank you very much. And Laurie, any particular views on your side in terms of which model would provide confidence to travelers and to Canadians?
Yeah, I think the nature of our business is so global, and the need for us to have a system that's globally accepted around the world is so important. The challenge we're facing is we just don't have the tests, as Lawrence was pointing out, that can provide that certainty with a rapid point of care test. our hope is that we get there, but it doesn't exist yet today. The one example, though, in thinking about a global approach, if we all think back prior to 9/11, what the aviation sector had to do coming out of that crisis was build into its processes security screening and the procedures and the technology and the equipment that's used. It really has been accepted from a global perspective, so that before you get on a plane, you're screened, your carry-on is screened, your check bags are screened. And that's a global, with a few exceptions, it's a globally accepted process so that you can, get on a plane at Pearson and connect through another airport in the world somewhere and carry on without being rescreened. And so if we think about a pre-departure screening from a health perspective in the same way, assuming we've got that verifiable single test, then that's ideally where I think we would like to see the model move to.
Thank you very much. I'm going to take a moment of pause here. I believe we have a question from the audience, and I'm somewhat mindful of time. It feels like we've just got the conversation started, so I'll be guided by TIAC when they need to draw our discussion to a close. The questions being posed from one of our delegates is, what is the best way for the industry to speak to the masses to shore up public support? Any particular views on that?
Can you repeat that? Sorry, Nicole, I couldn't hear you.
Sure. What is the best way for the industry to speak to the masses to shore up public support? So how does industry garner public support?
Well, I think we all have to be guided by the science, and that's our starting point. But with good science in hand, and I forget who it was that mentioned, I think it might have been Robin. I mean, Dr. Tam has come out a number of times and indicated that there is no evidence of transmission of COVID in air travel. So the measures that airlines have taken and the measures that airports have taken have proven to be effective in making sure that the virus is not spread in the process of air travel. Now, that doesn't mean that somebody who is asymptomatic isn't getting on a plane and traveling, but then what are the measures to put in place just to stop from that? And that's where testing comes in. But I think what I would encourage you all to do is to, deliver a message to government that shows confidence in the steps that have been taken by industry, to show there's a demand for air travel, that there's a balance here between keeping people safe and reopening economic travel in a way that's manageable and strikes the right balance.
And I just would add that multi-layered approach will deal with the fact that a testing upon departure will stop from anybody going onto the aircraft that may be in some way ill. And then on arrival, protect the community that they're going into. So there really is an important element of that multi-layered approach. I think it's consistency in messaging. We as an industry have to be aligned, government has to be aligned, and I think the tourism bodies have to get their work with the science, with the health bodies to ensure that there is an appetite for a little bit of risk in terms of how we do open up the industry again.
Thank you very much, folks. Unfortunately, we're out of time, but of course, the discussion will ensue beyond the Congress. We'll be watching this space with interest. Good luck to all of you as you continue with your various initiatives. Thank you once again for your participation. Of course, to all the delegates for attending, and to TIAC for the opportunity. Enjoy the rest of the conference and take care. Bye-bye for now.
Thank you.
Bye-bye.
Joining us for this TIAC talk. The team at TIAC has worked hard to create a program that delivers ideas, solutions, and tools that help you navigate the pandemic and the road to recovery. At TIAC, the focus is on ensuring that there is a vibrant and successful visitor economy post-COVID-19, and we can't do it without you. Please visit TIAC's virtual booth to become a member and support their efforts.